T-WRAPT, Cancer Treatment with Holistic Technology. What is cancer? Cancer. It is a condition in which the cells in the body are changed at the genetic level. This causes it to grow more rapidly until the body becomes out of control, and it spreads to other organs in the body. The current paradigm of cancer treatment is the same paradigm used in the treatment of infectious diseases, which has been active since before the 1950s. When a cell used to be a cancer cell, it must always and forever be a cancer cell. So killing all cancer cells is the only way to manage the disease. The paradigm effect of such treatment. It was found that in the last 50 years, the number of cancer deaths worldwide is increasing, even in Thailand. 2/3 of people diagnosed with cancer die in their bodies. In 2010, a total of 58,076 Thai people died from cancer, increasing to 124,866 in 2020, 2.15x increase in just 10 years. Studies over the past 100 years have found that surgery or even biopsy this results in the progression and spread of cancer cells. Marie and Clunit's 1910 study found that the tumor was transplanted in mice. If allowed to grow naturally, metastases occur if the primary tumor is removed. 3 years later, Tizer reported that surgery on a tumor in mice resulted in more metastasis than control mice that did not remove the tumor. After that, an animal observation study was conducted over a period of 20 weeks and found that there was no metastasis of the tumor. But if such an animal has to undergo repeated surgery by partial amputation of the liver, the incidence of metastasis increases to almost 100%, the author states. It looks like the tumor cells remain in the liver in a viable state, but stay dormant until it is stimulated to grow by some factors that still need to be explained. From liver injury, dormant or latent cancer cells, it may be triggered to spread nearly 100% higher, indicating that cancer cells may have shifted from a peaceful coexistence state with the host to a fast-growing cell. Gershon's experiment in 1968 found that animals with primary tumors were 100,000 times more resistant to transplanting identical tumor cells than were required to form a primary tumor, while rapid removal of the tumor resulted in the spread of necrosis. In 1976, Simpson-Heron et al. Conducted a study on lung cancer tumors. Investigate the impact of surgery on the host tumor system by analyzing both the kinetics of tumor cells and the host's survival time. It has been found that if the tumor is cut at the early stage, it gives good long-term treatment results and increased life expectancy. However, if removed at a slower stage later, it does not improve the treatment effect. Instead, the growth rate of the lump and its spread increased. Numerous studies have proven that surgical injuries of normal tissues promote the proliferation and growth of circulating cancer cells in the body. Angiogenesis formed as a result of wound healing mechanisms, as well as the various growth factors generated in the wound. It also causes tumor cell mutations. Schematic overview of pathophysiological mechanisms involved in the spread of necrosis in surgery. 1. Primary tumors release a bag that encapsulates the tumor growth factor, or EV. 2. EV creates tumor induction factors prior to metastasis in distant organs by stimulating tissue cells such as fibroblasts, macrophages, and mesenchyme stem cells to promote proneoplastic processes such as angiogenesis, inflammation, and changes in stromal form. 3. During surgery, cancer cells spread out of the primary tumor and are released into the bloodstream to form circulating tumor cells called CTC. 4. CTC creates circulation to distant tissue. 5. CTC tumor cell survival is higher from the effects of the stress and inflammatory response from surgery. Promotion of angiogenesis process by avoiding various immune systems, cancer cells can survive and eventually spread. Chemotherapy. It has a side effect that causes mutations of surviving cancer cells and makes them more ferocious. Scientists have found evidence that some cells survive the chemotherapy process, multiplying more quickly, but it's unclear why survival leads to more aggressive cancers. Scientists conducted experiments on healthy mice with chemotherapy injections and intravenous injection of breast cancer cells 4 days later. Within 3 hours of the injection, the cancer cells penetrated the junctions between the vascular cells and the lungs and attached to the structure of their walls. This is to avoid the bloodstream blowing it away. The endothelial cells on the inside of the blood vessel are like brick walls, and each brick adheres tightly to the next cell. What we found when we treated mice with chemotherapy was that it leaked endothelial cells, so tight connections or junctions were no longer tight, and cancer cells were able to penetrate into the brick layer. In control mice without chemotherapy, adhesion of cancer cells to the walls of blood vessels is relatively small. An investigation into the cause of death of cancer patients in England regarding the use of chemotherapy to treat seriously ill cancer patients. It was found that chemotherapy causes or accelerates death in 25% of all deaths. The NCEPOD inquiry investigated more than 600 deaths within 30 days of receiving chemotherapy, whether it's cancer treatment or palliative care to reduce symptoms. The results showed that 43% of patients who died suffered significant treatment-related poisoning. The investigation concluded that 19% of the deceased should not have undergone chemotherapy at all. Many modern chemotherapy is associated with toxicity to the cardiovascular system. This increases the risk of cardiovascular disease, including high blood pressure, thromboembolism, heart failure, myocardial dystrophy, and arrhythmias, renal impairment. These limitations limit treatment options and can adversely affect cancer management. The mechanism of herbal therapy is a multi-layered holistic mechanism that works simultaneously to stop cancer cells. First, mechanism: death of cancer cells. CARA effectively causes 45% death of HCT116, large intestine, cancer cells, while doxorubicin has 10.6% mortality. Second, the mechanism of inhibiting the communication and delivery of growth factors into the tumor is similar to the internal encapsulation of the tumor, T-WRAPT. It is a holistic form of biotechnology that blocks communications, resembling enveloping cancer cells or tumors inside, to inhibit growth factors that promote cancer cells. As a result, encapsulated cancer cells halt their growth and gradually die off in a cell cycle similar to normal cells. Third, overall gene regulation system. Cancer is a disease caused by mutations or regulation of gene expression that results in abnormal gene expression. In body cells, each cell has a greater number of base pairs. 3 billion base pairs, 99% of which are not expressed, so we don't know their true function, so they are called dark genes, but they are responsible for regulating gene expression or function. 1% of those expressions should be expressed normally. Errors in the expression of each gene are caused by an imbalance in the control of gene expression throughout the system.
ดังนั้นการใช้ยากลไกเดียวในการกดหรือยับยั้งการทำงานของยีนเพียงตัวเดียวเช่นยามุ่งเป้าหรือ target therapy จึงส่งผลกระทบต่อสมดุลของยีนทั้งระบบอย่างหลีกเลี่ยงไม่ได้ซึ่งสะท้อนให้เห็นภาพชัดเจนด้วยผลข้างเคียงที่อาจคาดไม่ถึงและการกลายพันธุ์ของเซลล์ที่ทำให้ดื้อยารวมทั้งการกลายพันธุ์ของเซลล์ปกติที่ตอบสนองต่อการยับยั้งยีนนั้นๆแต่การศึกษากลับพบว่าสมุนไพรแบบองค์รวมนั้นสามารถสร้างความสมดุลในระบบการแสดงออกของยีนทั้งระบบได้อย่างน่าประหลาดใจ
Evidence from CARA herbal pharmacopoeia testing in large intestine cancer cells. Two groups of gene changes were observed in two ways, balancing the expression of genes related to tumor inhibition and tumor activation by reducing the oncogene group and increasing the tumor inhibition gene group to balance gene expression, while increasing the expression of anti-inflammatory gene groups and decreasing the expression of inflammatory-inducing gene groups. Inflammation is known to be the starting point and promotes cancer growth and spread. The result is the balancing effect of gene expression throughout this system. As a result, the cell growth cycle returns to normal, reduces the growth of abnormal cells or cancer cells. This results in lasting therapeutic effects by inhibiting cancer metastases and recurrence. The result is a slowdown in cancer cell growth or non-growth. This prevents the body from getting sick or dying from cancer, and that's living with cancer without being attacked by cancer.